All right. Approaching us is a legend in cardiology. Would you say so, Priyanka?
100%. Yeah.
Do you mind introducing yourself?
Oh, well, my name is Martha Gulati. I'm a professor of cardiology at Cedars-Sinai, the Smidt Heart Institute. I'm the director of prevention, and I'm also the associate director of the Barbara Streisand Women's Heart Center.
You've had an incredible career, trailblazing, leading the way for women like us, coming after you in cardiology, in prevention, in women's heart disease. I mean, how do you continue on in this path? Like, what keeps you motivated to keep showing up to do this job?
Oh, well, people like you guys, I mean, I think that, it's the young energy now that it's really changed cardiology. Some of us were talking about this today. So when we come to meetings when we were at your stage, first of all, there wasn't very many women here. And so it was kind of a lonely experience. Like you just didn't really know as a junior faculty, like who you were supposed to hang out with and where were you supposed to go. I didn't acquire those skills during training, to be honest with you. And these meetings, although they were wonderful always for the science, they didn't actually have programs that made us connect. And I think that's what's really changed in cardiology is that we're more connected than ever before. And we have a community that we built, especially with the women in cardiology, which is a real wonderful part of being a cardiologist. But I think for the work that we all do clinically, I think what motivates me probably every day is my patients. I have the fortune of taking care of wonderful women and predominantly women in our Women's Heart Center. And, I think that this is an exciting time. I'm a preventive cardiologist. And so when I started out in this career wanting to do prevention, I didn't actually have a lot of tools. Really, we didn't have much. And now it's such a changing landscape. And that makes it exciting. I mean, the one best thing about cardiology is, right, no day is the same. We can't say, oh, it's the same old. I can never say that, which is kind of amazing.
I think you mentioned some really important points. It's like, if it doesn't exist, don't think it can't happen, right? And so you've been one of those people who's created pathways in so many different areas of cardiology. And from ACC 25 so far, I know we're still kind of early in the meeting. If you could tell us one takeaway that every heart team member should know from this meeting this year, what would it be?
Well, it's just more and more evidence that GLP-1 receptor agonists are changing how we care for patients. And I think that the STRIDE study that we heard about yesterday was yet another example. It didn't really think about PAD and these medications because not all of them actually have obesity. And so the way that elegant trial was performed, I think it's one of the yet another piece of the evidence that will change clinical practice. And I think also, of course, we had another study with an oral GLP-1 receptor agonist, which also is potentially a game changer. I don't know what the cost is going to be, but I imagine it will be less because a lot about these medications has been related to the cost because they're injectables and because of the transportation and keeping them cold. So, an oral medication also may help us. So I think we're in the era of GLP-1 receptor agonists or weight loss medication because there's many new drugs being looked at, and we're going to have more than just what we have right now in a very short amount of time.
I think coming from the perspective of an interventional cardiologist, the further I get in my career, the more I recognize how critical it is to prevent disease. And so I'm so grateful to have colleagues like both of you who are basically like creating this pathway and also sharing this information because it's hard to keep up. There's a lot of innovation happening. What would you recommend for someone like me to keep up with all these changes that are happening in the cardiometabolic space?
Well, you could come and join prevention because actually it'd be more fun than interventional.
Yes. So invited to the prevention societies. Cannot wait.
And I always call us early interventionalists. That's my tagline. So I think but I do think there's crossover. And I do think that we, just like we follow you for updates when you go to your interventional meetings, I'm always watching to see what's the latest data out there. If you don't make it exciting to me, I'm not going to read it. But when you drag me into it because, it's related to something I do. Social media has really, it curates our literature of what we read, especially outside of our own community. So I do think one of the things is, of course, there's a lot related. Obviously, every disease within cardiology relates to interventional because you have to be watching the heart failure movement. You have to be watching the valvular heart disease. You have to be watching prevention. You have to be on top of all of this. But I do think that some of the ways is using social media to trusted people that are experts and guiding you. It's not all about social media, though, either. I do think once in a while it is really a good idea to even go once randomly to a meeting that isn't your specialty, because I do think even I have gone to an interventional meeting and I found it incredibly engaging. I actually thought it was funny. I remember them showing a patient with a really complicated coronary anatomy that they wanted to talk about, and I'm sure there's different devices that they were discussing. But what we recognize as the preventive cardiology people in the audience were like, why are they on like such a small dose of a statin? Like where is the LDL control? And so, then when we brought that point up, they're like, yeah, that's a good point. We need to be interchanging, which is why I love ACC and AHA as two of our big meetings in the United States, because it does kind of try to bring everyone together. I mean, I was sitting in the interventional late breakers today, and I do that intentionally if I can make it, because I'm going to read about the prevention ones, but I'm not necessarily going to read about the interventional ones. But I like hearing about them. A lot of them today, there was a lot of valve disease there. I was like, okay, well, at least I feel like I have a baseline knowledge. And I think that's what we all need to do a little bit of. We can't live ever in our silos. I mean, there's so much that overlaps, and prevention, of course, overlaps with every disease state, and every disease state probably overlaps somehow to the other ones as well.
This is such an elegant answer to this question, and now I'm going to expect you to take me with you to ASPC next year.
You should come this year.
Oh, it's happening.
Boston.
When is it? I actually have been really wanting to, but it's almost like that mentality of like, I'm intervention, like stay in your lane. But I think you're right. Like, I don't think that's the right way to look at it.
I really do. I think that, again, I know that when it's like specialized, you're like, okay, what am I going to do there? But I do think that once in a while it's important. And I also think that's why you guys invite us sometimes to your meetings, and we sometimes invite interventionalists and other specialists to our meeting, because we all need to be having that dialogue together. If we're not in the same room, there's aspects of it that we won't understand.
I think that's a beautiful summary of everything we do in a heart team in every context. So one unrelated question for you. What lights you up outside of the cath lab? Like, I know you as a person who I go to for like inspiration in many different areas, including fashion, everything. What lights you up?
What lights me up? Well, my dogs light me up. So if anybody who follows me knows that my two crazy dogs are crazy and lovely and, love you with unconditional status. So I think that's one thing. My husband is my supporter all the time. He's been coming to, and he has to be here for work at ACC, but anytime he can make it to one of my talks, he's actually been in the audience. So he definitely, I should have said him first before the dogs. Gareth, forgive me. But the other things that light me up is like spending time with my friends and spending time even by myself. I think I'm, people say they're an introvert, extrovert, or vice versa. I don't know what the right description of me is. I'm not scared of being around people, and I enjoy it, but I also really do love being at home and being I'm a bit of a homebody. And so, sometimes the joy for me is like doing gardening in my backyard, and that gives me a lot of joy, but also just spending time thinking about and reading and doing the things that sometimes we're so busy and we don't get to slow down. So those moments that we get to slow down, I absolutely love. And then I'd say France. France is the other thing that lights me up. I love going to France. I want to retire there. And so I just get a lot of joy when my husband and I go there on vacation, which is about 5 weeks and 2 days away.
Down to the day. That's amazing. Thank you so much for sharing with us. And thank you for inspiring. I mean, this is your legacy. Like, you've inspired so many people. So we really appreciate you.